And welcome again to our show. We are continuing our series with Dr. Stanford Owen with the Center for Health Management in Gulfport, as they call him, Dr. Diet. And we're continuing our series actually talking about diabetes and PrescriptFit, something that you have that are helping people. Let's talk a little bit about, the different things about PrescriptFit. Diabetes, of course, Mississippi #1 in the country for people with type 2 diabetes, and how it can affect their lives, and how PrescriptFit and what you teach them can help improve their lives, correct?
Correct. As I say every week, the cause of type 2 diabetes is food. I'll say that again. The cause of type 2 diabetes is food. The treatment of type 2 diabetes is food. And if patients have not had 12 weeks of intensive nutrition therapy to treat the diabetes, then they're falling short of the standard of care for treatment of type 2 diabetes. The basics are really fun, very simple. I worked 30 years to make it simple. And number one, you have to get sugary drinks out of your life. Say that again, you have to get sugary drinks out of your life. Soda, juice, milk, sweet tea. Diet drinks are fine. So diet soda, diet juice.
What about, you mentioned milk, and I love to drink milk. What about organic milk?
Organic makes no difference.
Really?
No, it's marketing gimmick. It's a sugary drink that causes type 2 diabetes.
Okay.
Okay. Second principle is the saturated fats, or fats plus carbs, is the primary cause of type 2 diabetes. So down here we have pork, beef, dairy, and starches: wheat, corn, rice, potatoes. That is the cause of type 2 diabetes combined with simple sugar. Okay. These foods do not cause diabetes. So seafood, poultry, non-starchy vegetables, eggs, nuts, whole fruit. Basically, we want our diabetics to eat 90% of the meals out of this and splurge 10% of the time out of the really decadent, great-tasting foods. And that's the fundamental principles. Number one, get rid of sugary drinks. Number two, to eat 90% of the meals out of the purple. And number three, eat 10% of the meals out of the gold. And 90% of the time, that will either reduce or control the type 2 diabetes.
So you need to add the healing foods first.
Right.
Add non-toxic foods second.
Right.
And the order is for taste.
Well, the science behind this, the fundamentals behind this are that we're animals, we're creatures of anticipation. And so what we do is we add the really tasty, non-toxic diabetic foods first. Mm-hmm. The ones that are filling, the ones that are satiating, like seafood and poultry. Some people like vegetables. They like the variety of vegetables, so they're high on the scale. And then we add eggs, nuts, and whole fruit. And so these are the foods that'll heal most patients. And of course, the PrescriptFit products are intended to treat type 2 diabetes. The way that they work is that the amino acids essentially go into the cell without the need of insulin. So they heal first, and then we add the tasty, filling, satiating foods second. Once they're finished with this phase, then we add the high-fat, high-carb foods last.
How important is portion control?
It's irrelevant. Again, it's not the portion that's killing patients or causing type 2 diabetes. It's the type of foods. So the portion is irrelevant. So when they're eating these foods, we want patients to eat all they can eat. They want them to be full. Weight loss is unimportant in type 2 diabetes. Now, most patients who follow this strategy will lose a lot of weight, but it's relatively unimportant in controlling the disease.
Now, there's a difference between being full and gorging yourself. Because some people, they'll just eat and eat and eat and eat. And as you said, excuse me.
Well, type 2 diabetics are innately hungry.
Right.
That's not a problem. As long as they're eating foods that are not going to aggravate the diabetes, like the seafood and the poultry and the nuts, they can eat all they want. And of course, if they use a PrescriptFit product with their meals, then they're innately more full. But
so choice is critical.
Choice of the food product is critical in order to feel full and feel satiating and have great taste, which is important to everybody.
Now, let's talk a little bit more about details. As far as how you get them on this food phase, how you get them eating correctly, eating the good portions, And, you know, exactly what is, you know, what do they do?
The first thing we do is we have them for either 3, 7, or 14 days, as much as they can tolerate.
Okay.
We have them do just Prescript-Fit. And what that does is it helps rapidly improve the cellular metabolism.
Kind of cleans out your system.
So to speak, the blood sugar drops, the need for medication improves, the patient feel better immediately, the fatigue and the breathlessness and so forth immediately go away. And then we start adding food groups to that. So as they get their disease under control, we add a food group that they can sense every single time is either helping them or making them feel worse. And everybody's tolerance is different. So some people can do 3 days before they add the next phase. Some people can go as long as a week or 2 weeks. Depends on individual tolerance. And so as soon as they can't tolerate it anymore, boom, they go to the next phase. It's really, really simple. So everybody's individual tolerance is factored into this.
And one of the good things about this, Dr. Owen, is that you watch this closely with them, each individual person, as to what, you know, how they're doing.
Sure. Well, a healthcare provider should be involved in the treatment of type 2 diabetes. And
Sure.
we're in about 100 clinics around the state. And in those clinics, the healthcare provider is always managing, 9 times out of 10, managing the medications out of their life. So if they're on insulin, the first thing we do is stop insulin. If they're on drugs like glypiride or glyburide, we have them stop those medications. And then if there are other medications, we try and chop those down as able. But our goal is to get every patient off insulin. If they're on insulin, I've failed. Now, some patients can't tolerate any food deprivation. That's fine. We'll start them out in phase 7 or phase 8. All they're doing is adding Prescript-Fit with all of these foods from day 1, and they still get control of the type 2 diabetes. Now, the really good foods, the pork, the beef, the dairy, and the starches, the ones that are causing the diabetes, in the end, we all get 80 years plus or minus 10 years. And so adding these 2-3 meals a week is not going to break the bank in terms of shortening your life.
Right.
So it's something to look forward to. Yes, I got Christmas coming up. I've had Thanksgiving. I've got the wedding, the wake that I had to go to. And those food events are still manageable. You got a favorite restaurant you want to take your wife to. That's fine. That's a splurge.
The important thing is to do is not overdo it, not overdo the splurge, so to speak.
The splurges we want to limit to 2 to 3 per week. After the diabetes is controlled, that won't break the bank.
Okay.
And we have them keep track of that on a little calendar accounting system, and it's very, very easy.
Okay. Well, this is we're continuing our series here, talking about diabetes, type 2 diabetes, how to deal with it, how to work with it, how to eat properly with it. Be sure you tune in. Also, you can catch you on News Radio 104.9 every Saturday morning from 9 till 10.
Starting in January.
Starting in January. So, and we'll keep you posted here, of course, too, with Dr. Stanford Owen with the Center for Health Management.